a dear friend, the Senior Director of Molecular Pharmacology, Patrick Sarmiere from Ovid Therapeutics. Patrick is here to talk a little bit about what Ovid is doing, and hopefully everybody got a chance to look at Patrick's wonderful presentation too. So this is really exciting, and it's exciting for me to welcome my friend Pat Sarmiere to the stage. Hey, Pat.
Hey, can you hear me?
Yes, we can hear you, Pat. I know you're having some connectivity problems, but we can hear you and you're here. So thanks so much. Good. Pat, thanks for being here. It means the world to the community. You here, and also your presentation. I know everybody got a chance to watch it. I've watched it probably 5 or 10 times, but then again, I have the pleasure of bothering you and talking to you every single day. So Pat, I just know how hard you work every single day for this community of people who are here in attendance today. So thanks for coming. And I have a couple of questions that came in after the presentation, and we won't take too much of your time, but I'm going to go through them. And again, everybody, if some more questions pop up, just punch them into the Q&A. I have that up here, but I'll just jump right in to the first question that came is one that seems to be a theme a bit today. We've heard it's about treatments for genetic disorders and conditions, and will developing those treatments help with overall development, meaning cognition, behavior, things that that many of our kids are developmental than their actual age because of these conditions and how the genetic condition affects the body and the brain. And we're wondering if you might shed some light on how certain treatments can possibly address the constellation of problems versus just one specific symptom.
Yeah, I think that's an important thought. And I think I'm going to go back to what Wendy was saying earlier in the day, that timing of intervention is going to be critical. And if we go in at the molecular level and repair what's happening, in the KAND disorders, we hope to change and have an effect on all the symptoms. So we're really looking to change the neurodevelopmental trajectory in people with KAND. So from our perspective, and I think it's a global perspective, if the earlier and better you can affect the deficiency in KAND, with the mutations, the more pronounced the effect will be on all the symptoms that these kids are experiencing. So we're really thinking about early intervention and affecting the global disease, not just the symptoms, right? So we're looking for disease modification.
That's great. Thanks. Yeah, it makes a lot of sense. And that was clear in your presentation too. Another part of your presentation, I know a lot of people were really excited about, both had one of those, oh my gosh, what is this? What does this mean? And I think it's, it would be really great if you could talk about Aptamers. What is an Aptamer? And have they been used in treating genetic disease before? And is this a novel approach, and just what it means and what it actually is? People might really benefit from that.
So Aptamers so they're another oligonucleotide-based therapy. But what Aptamers are they're kind of, if you've heard of antibody therapeutics, they're kind of along those lines. And so what we're hoping to do with an Aptamer is go in and bind up the mutant forms of KAND. And so Aptamers have that ability to really hone in, I think of it as a smart bomb or a smart missile that can really go in and find that particular molecular unique property of the mutant KANDs and bind to that and get that mutant KAND out of the picture, which is mucking up, if you will, the cell biology of the neuron. And so if we can use Aptamers to get into the target cell population that are affected in KAND disorders, then we hope to allow that wild type or the normal KAND to do what it's intended to do and transport that material up and down the axons as it's intended. So Aptamers are just another molecular technique. They have some distinct advantages, I think, over some other techniques that are out there, not necessarily better, but maybe it's more efficient, faster to production, faster to screening, and maybe even safer and less immunogenic. And so they give us an opportunity to develop a safer, potentially more therapeutic compound. And it's novel, and there's not a lot of people working in that space right now.
Great. The thinking outside of the box is for us is, don't think outside the box, but just get rid of the box completely. And I think it's creative scientists like you who we are so thankful to be working with. I wonder, continue on the Aptamer. How is an Aptamer administered? How might this one be administered? Yeah. And what administration looks like or could look like with this potential therapeutic?
So I think there's a lot of questions to be, I think there's some things we have to understand about Aptamers, but we think we can develop an Aptamer that can be delivered systemically, that is by IV administration. That's the dream, and that's what we want, and that's what we're aiming for. Ultimately, it will depend a lot on the properties of that Aptamer and the target, how well the target cells take them up. But there are things we can do to those Aptamers to make them more available to the CNS, or the brain, the neurons that we need to target. So there's opportunities there for us to improve that delivery system. Worst case scenario would be intrathecal delivery, so that's a spinal injection. Best case scenario we see is a systemic, relatively infrequent injection that will have long-lasting effects. And so that's what we hope toward, and that's what we're aiming to develop towards. But really, the science is going to drive us there. We're kind of a little bit agnostic, or we have to let the science tell us what happens there.
Right. And one thing that was one of the many things that was so exciting about your presentation and dialogue that we have, and is there seems to be multiple therapeutic approaches sort of on the horizon. And I'm wondering if there are, one question that came in that's a good one is, are there other therapeutic approaches that you might consider or that you are considering?
Yeah. So we are not putting all our eggs in one basket. So the Aptamers is one story, I think, and is an important story, and it's something we can work on. And with, like Omid was saying, with the iPSC cell lines that you guys have made available to us, and working with Wendy at Columbia University, we have the ability to test those things quickly. We are also looking at shRNAs, which is another form of RNA like an ASO, but might be able to have a longer lasting effect in the cells once we deliver them. So that's more of we don't want to say one and done, but one and less frequently done than maybe ASOs or Aptamer therapy. So we're really looking at that strategy. And then I'll be honest, we're really all in this right now for the KIF1A org at Ovid. We are building a team, and we're going to look at all possible ways we can approach this. And so we're not going to stop there, I don't think. I think there's going to be other technologies. We're bringing in technology platforms that are going to maybe give us the ability to do things we weren't thinking about a year ago. And so we're not stopping there. I can't really say what we're doing yet because I don't know what's happening, but I know we're looking at opportunities so that we have better technologies, better ability to target specific or multiple KAND mutations at one time.
That's incredible, and that was one of the questions that just came in: is the targeting of multiple mutations. And I know what's so remarkable about this Ovid collaboration and everything that's going on with all your team and everybody's working on, Pat, is that sort of multidimensional, holistic approach to disease. So it's something that everybody notes and is so excited about. So thank you for such an incredible presentation. I have one question that came in, and I think it's a good way to sort of wrap up the follow-up that came in from your presentation. And again, everybody, please go watch 3, 4, 5, 6 times Pat's presentation because it's so chock full of informative information. But how can our KIF1A families, patients, communities, and clinicians, and what can we do to help drive the more rapid discovery of therapeutics? What can we do? What's our part? How can we help?
I think the theme is really going to keep coming up here. It's stay involved. I think the natural history information that Wendy and her team are gathering is going to be critical to getting us to the clinic faster and doing safer, better studies. So while I'm a molecular pharmacologist, I'm thinking about the very basic, research stuff. We have the clinical operations and clinical teams and regulatory teams that are backing this. And we want to be thinking about the clinic today so that when we have our product and we know how to use it safely, we can move there quickly. So staying involved, being part of natural history, so we understand how to know when our drugs are working in the clinic is so critical. And I have yet to see an organization like KAND do this, like the way you're doing it. So just keep it up. It's so exciting to be part of it.
Yeah, and Pat, thank you so much, and I reiterate it to the Ovid team every day for being such a central part of this community, and all the work that you're doing just means the world to us. And again, that presentation is such an incredible resource. So I hope that everybody tuning in here gets a chance to go back and watch it again. But there you have it from Pat, another great message and another great reminder that participation from the community is paramount, and we're going to get to the top of this mountain faster if we're all participating together. So Pat Sarmiere from Ovid Therapeutics, thank you so much for taking the time out of your day and for taking time to make that presentation and just being such a big part of our community. I really appreciate it. And so do we all. Thanks, Pat.
Thanks, Luke, and everybody. Be well.
Okay, you too. That was awesome.